Hi everyone, I'm Professor McGrath. In this video, I will demonstrate nasogastric tube insertion safely and effectively. This is a foundational nursing skill, and safety is critical to reduce aspiration risk and prevent airway or tissue injury. Before beginning, always verify the provider's order, identify the patient using 2 approved identifiers, and assess for contraindications. Let's get started. The supplies you will need for the NG tube insertion is the barrier drape that we'll place across the patient's chest, the actual NG, some lubricant, tape, a glass of water with a straw for the patient, your Toomey syringe for aspirating the contents, and of course your hand hygiene. Begin by performing hand hygiene and then verify the patient's identity using 2 approved identifiers. Raise the bed and place the patient in a high Fowler's position. Then you'll set your suction up as ordered. Perform hand hygiene again, and then we place a protective barrier across the patient's chest. Apply clean gloves. We want to assess the nares for patency, so select the nair that is more open. We'll open up our NG tube, then we want to measure the tube from the nose to the earlobe down to the xiphoid process and place a mark there. You'll lubricate the distal end of the tube with a water-soluble lubricant. Now, begin insertion in the selected nostril, aiming towards the back and downward. When you reach the nasopharynx with the tube, flex the patient's head forward and encourage swallowing. Continue to advance the tube until you reach the pre-marked length. If gagging or choking occurs, stop advancing the tube and allow the patient to recover before you continue. Secure the tube to the patient's nose and then gown. Remember that the X-ray is the preferred method to confirm initial placement, according to your agency policy though. We'll aspirate the gastric contents and assess that for color and pH. Connect to the tube to suction as ordered, then dispose of any of your supplies. Remove your gloves and perform hand hygiene. Document the procedure to include the tube size and length, the nair used, placement verification, patient's tolerance. And that's it. That completes the nasogastric tube insertion. Patient safety depends on correct technique, clear communication, and careful monitoring throughout. Always remain committed to maintaining patient comfort and dignity and reducing risk with every performance of this skill. Thanks for watching.